Hello everyone. In this video, I want to discuss with you probably a challenge that I face myself and some of you might face as well, which is treating patients of the same ethnicity as yourself in a foreign country. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice in Hervey Bay in Queensland. It's called Lakeside Dental Spa. You can check the details below. So first, before I discuss that, I just want to make clear this video doesn't be taken out of context that I'm not against any ethnic backgrounds or any things that can affect certain things that I will talk about in this video. It's just purely my own observation and also the observation of other dentists I have spoken to as well. So let me tell you a story. So as you're aware, I moved from Egypt to Australia in 2007, so more than 14 years ago. And I practiced in Egypt for around 2 years before moving into Australia. And the challenges that I faced, I will explain to you in one story, for example. I remember many years back, I've seen one patient from my own ethnic background, from an Egyptian patient. He was seeking some treatment and he had a very deep bite with a lot of erosion, a lot of wear in his teeth, and my recommendation was a full mouth rehabilitation. There was no room to build the teeth up, and my recommendation was a referral to a prosthodontist to manage this case. The patient went for a second opinion with a prosthodontist and then decided not to go ahead with treatment. And the patient asked me whether it would be wise to go back to Egypt and get the treatment done over there, because it would be a lot cheaper, of course. And my advice was this kind of treatment needs a lot of maintenance, require multiple visits, multiple appointments, sometimes a long temporary phase to make sure the bite is in a good position before going with the finals. It's just not the type of treatment that can be done in 2 weeks or 10 days. But the patient went against this advice and went to Egypt anyway to get the treatment done. And then when the patient came back, and of course, doing a full mouth rehab in 10 days can be very challenging, especially his bite was quite difficult as well, not like a straightforward full mouth rehab. And when the patient came back, he booked an appointment because he was having a lot of sensitivity and he had 2 front teeth chipping and breaking as well. And not just that, the patient expected me to call his dentist back in Egypt and get guidance from them on how to fix or re-cement those crowns. And when I checked the teeth, there were some issues with the crowns. Some crowns had open margins, and the bite wasn't very even as well. There was a lot of issues that needs even more complex rectification. And the challenge I want to talk about is simply, I find in my own experience, when treating patients from my own ethnic background, they expect from you, sometimes they ask you for discounts. They expect you to provide more compromised dentistry until they can go back to their home country to have the treatment done for cheaper. I had similar issues with when I discussed with other patients or other dentists from different countries as well. I have friends from India, I have friends from China, and they explained to me something very similar, even East European countries. And again, this is nothing against those countries. I think where I come from, there is a lot of great dentistry there. But the difference between dentistry in Egypt and dentistry here is the lack of discipline when it comes to disciplinary actions by the dental board if there is any sort of malpractice. So there could be some sort of adventurous dentistry being provided, and that can, those patients sometimes when they come here, they're expecting that from you. Or sometimes you could be friends with them outside, especially if you live in a small town, there's a high chance you could be within their circle of friendship as well, and then that put more pressure on you to submit to the request a little bit more. So how do you manage that? It's very hard and very challenging. If you wanna, my advice is to keep your practice of dentistry at the same level, regardless of the type of patient in front of you, even if they have expectation from you to provide extremely compromised dentistry until they go back. If you find it's completely outside the scope of compromise and it's bordering on malpractice, you have to draw the line and be very polite about it and making it clear that you can provide this type of dentistry. I'm very sorry. Some might understand and they might move on to another dentist. Some might probably dislike you for it and not accept you for it, but it's okay. As long as you can provide the dentistry that you're comfortable with and don't submit to the pressure, I think you will find life a lot easier for you. If you face the same challenges or if you have any comment, please make sure you comment below. Please like and share it to your friends and colleagues. If you find this content helpful, please make sure you subscribe to the channel so I can provide you with more content. Thank you so much for listening, and it means a lot to me.